Penile implants are best used for men that are not able to obtain a natural erection. Insurance covers a penile implantation in almost every circumstance. We have found in our practice that fewer than 2% of people do not have insurance coverage for the procedure. Penile implantation falls into two main categories. One is an inflatable penile prosthesis, which is overwhelmingly the most satisfactory and the highest utilized. And then there are also malleable or bendable penile prostheses that do not involve inflation. An inflatable penile prosthesis utilizes different components with a pump and a series of balloons or cylinders in the penis. The inflatable implant looks natural when it is deflated, and it is very rigid when it is inflated. A malleable or bendable penile prosthesis I equate to a version of a pipe cleaner in the sense that it can be bent down or bent up for utility, but it doesn't have an ability to deflate and inflate and look as natural as the inflatable penile prosthesis does. Implants are sized to a man's penis size. And typically what I tell every patient when I do an implant is that we will cram every centimeter of implant that we can safely get into you, but it all depends on the anatomy that you bring to the table. An inflatable penile prosthesis typically has three components. One is a balloon that is within the penis itself, and there are two balloons next to one another called cylinders. The second is a different balloon that sits in the belly called a reservoir. And the third component is a pump that sits underneath the skin in the scrotum. That pump is squeezed numerous times, and with each squeeze, a little bit of fluid moves from the reservoir in the belly into the cylinders in the penis. As that penis fills, that rigidity of the erection is achieved. When the erection is done, which can be at any point in time when the patient is satisfied with the end of the sexual act, then a different button can be pushed and that fluid can return, restoring the natural appearance of a flaccid penis. Ejaculation and sensation are not impacted by the inflatable penile prosthesis. Those tubes and channels are not interrupted in any way. If a patient could ejaculate and have appropriate skin sensation beforehand, you can be able to do that after an implantation. The implant is fully underneath the skin and is fully concealed. The implant is made of a synthetic plastic-like material that is completely inert and safe for use in the body. Implantation is typically performed with a small incision, usually 1 to 1.5 inches, that could be below the penis or above the penis. I favor an approach below the penis, at the junction of the penis and the scrotum. Through this one incision, moving in different directions, we're able to implant those three components of the device. The procedure itself typically takes between 35 minutes and 1 hour to do and is performed as an outpatient without admission to the hospital. The recovery from penile implant surgery is varied from person to person, but typically is between a 2 to 6 week time frame. Most patients are operating the device at 4 weeks time, but occasionally you'll have people who are ready to go earlier, and occasionally you'll have people who take a little bit longer. So once discomfort from the procedure has resolved and swelling has resolved, the implant can be utilized. That time frame is typically at about 1 month. An average lifespan for the penile implant through our practice has been about 9 years. Satisfaction rates for 3-piece inflatable penile prosthesis implantation typically are well over 90%. There are several risks for penile implant surgery, and it's important to make sure that one is a safe and appropriate candidate for this before proceeding with surgery. The predominant risk is a concern for infection. Infection of a penile implant might require removal. It is a rare issue, but it's one that should be screened for and assessed properly and handled properly during surgery. Other risks can include device failure because there are moving components and connections that are made. And obviously discomfort and swelling around the time of the procedure is another potential risk.